All right, there we go. We have a couple people in here. Thank you for coming in early. It's appreciated. We're just going to give everyone until 12 to join on. All right, so it's 12 p.m. I'm going to give people another couple minutes to join. But for the ones that are here, can you please type into the chat a number 1 if you can hear me and if you can see the presentation? Great, thank you, Tanya. Got it, Ludlow. All right, welcome, welcome everyone. We're just allowing people to get situated and online for the next minute or two, and then we're going to go ahead and start. All right, everyone, I am back. Sorry about that Wi-Fi issue. Just give me a 1 minute to get situated back to the presentation, but we're going to start right away. All right, we're back. So I'm going to do a quick test just to know who's here, who can hear me and see the presentation. So just put a 1 in the chat. So except for Tanya and Ludlow, I know you can see and hear me as well. But for everyone else who just came in, please let me know. Again, the Wi-Fi almost didn't want this to happen, but we got it to work. All right, cool. All right, so that's good. Let's get started. So welcome to another NJ Thrives Thursdays. So this is a weekly webinar series for New Jersey small business owners. We hold it every Thursday at 12 p.m. So I'm your host, Christian Pichardo, NJSBDC marketing consultant and CEO at nelumamedia.com. And who we are, we're the America's New Jersey Small Business Development Centers Network. Now that's a mouthful, but just say NJSBDC. And we're a statewide program that's powered by the SBA and partners. We help small businesses in New Jersey with no-cost small business consulting, training and events just like this one that start at $0 and exclusive small business resources that are only available to SBDC clients. So you'll see on the right that we have a location in every county. Well, that covers all counties of New Jersey. So we're going to talk a little bit more about that at the end of the presentation. But for today's event, we have Marie DeSanti, and she's the program coordinator at Rutgers Center for Public Health Workforce Development in Rutgers University. And today's all about business health and safety for any pandemic. So we know that we faced some harsh times, right, in the past year or two. And it's really crazy, right, when you think about it, how this pandemic just came up pretty much out of nowhere in 2020. And now here we are. So before that, 3 things to keep in mind. Type your questions into the Q&A box. And we're going to have a Q&A session at the end, and we're going to go over all your questions after the webinar, after the main presentation. Number 2 is at the end, you're going to get a 3-minute survey, and we'd love for you to give us your feedback. This helps us further develop our events and know what you guys want so that we can deliver it. Once you submit that survey, you're going to get sent a link for the webinar materials. So that means the recording of this video and the presentation slides. And number 3, just by joining this event makes you eligible for the Upgrade Your Business certificate. More info about that at the link right there. So the agenda for today is just a headline, our webinar, and the Q&A session. So for today's headline, I found some very good stuff for you guys. So there is a pre-registration for phase 4 of Emergency Assistance Grant Program by the NJEDA. So they reopened it basically yesterday morning at 9 a.m. So there is about 200 million in additional funds that are going to continue to support restaurants, bars, micro businesses, childcare providers, and other small businesses and nonprofits. So please make sure that if you are eligible, well, to know if you're eligible, please go to this link here. I'm going to drop it into the chat so you could save it because I think this is extremely important for small businesses. So there you go. So that is the headline. And now you're going to get to enjoy the webinar. So I present to you Marie DeSanti.
Hello, everyone.
Awesome. Thank you for coming on. You can go ahead and share your screen and get the show going.
Yep, 1 second. I'll do it. All right, can you see that good, Chris?
Yep.
Okay,
we're good
perfect.
to go.
All right, so thank you everyone for joining. As Chris mentioned, we'll be talking about health and safety for any pandemic today, including creating health and safety programs. I'll kind of orient you in a second once we get past the introduction. A little bit about myself. I am with the Rutgers School of Public Health. I have spent the past year or so working on issues of COVID, and specifically the last 6 to 8 months, helping businesses and workplaces respond to COVID, as well as doing more generalized health and safety education for businesses and workplaces. I have industry experience working as a safety coordinator, as well as some research experience in epidemiology. The objectives of today are to understand how to sustainably integrate occupational health and safety into your business operations, to introduce occupational health and safety frameworks and tools to set up your business for success in the realm of health and safety, and to apply these different tools to infectious disease and other hazards beyond COVID. So we'll kind of give it a more broad framework so that you have the tools you'll need to protect your customers, your workers, whoever might be interacting with your business from any hazards or dangers that might be applicable to you. And it's going to be different for every workplace.
Awesome.
So let's get started with some of the basics. What is workplace safety? So workplace safety refers to the working environment at an organization or a business, and it encompasses all factors that impact the safety, the health, and the well-being of your employees, your customers, clients, yourselves, whoever really is interacting with that organization. And I actually was really excited for the presentation today because a lot of times when we think about workplace safety, we tend to think of really traditional, more industrial businesses who may be represented on this call, but I also really like to think about it broadly. Workplace safety applies to small businesses, it applies to restaurants, retail stores. It specifically applies to a lot of places, that have been most impacted by the pandemic. And I know, we're all working towards reopening and doing that safely. And, we're excited for that. So that's why I wanted to talk today about some frameworks that would be really set you up for, the next few months or the next few years, whatever it is. And I show this image we're all incredibly familiar with by now on this slide, because I also like to mention that COVID-19 really placed a new lens on workplace health and safety, because all of a sudden, every employee, every manager, every owner everywhere was concerned with the well-being and safety and health of their workers, their clients, their customers, everyone. Whereas, not to say they weren't concerned before, but it really came to the forefront in the last more than a year or so.
Right. And I think in terms of COVID, people are worried, if they're going to contract it, just going to, the local restaurant. So
exactly,
having these sort of guidelines in place, it is not only good for health, but I think it eases customers' minds. We'll probably bring in more customers, right?
Yeah, exactly. I think building that trust is this is obviously we would have preferred no COVID to happen, but this can be an opportunity to build that trust between your customers and your business, your workers and your business, showing them that you're thinking about them and what might make them want to come into your business or your retail store, your restaurant, whatever it might be.
Right.
So how I designed this webinar is to talk about creating a program that can help you do that. And like I said, this program is designed that anytime you identify a hazard that might be a safety concern, you can really apply these steps and these skills to control that and to make everyone involved feel safer and make them feel more confident in your business. So what is a program? It's, at the end of the day, it's a documented plan design to help prevent injuries and illnesses from occurring. It's going to be unique to every organization. As you all know, a retail establishment is going to have different risks than just a 4-person office where everyone can work from home. They're designed to be anticipatory and preventative in nature. So as we mentioned in the beginning, this really could be for any infectious disease, any pandemic. We hope we never have anything on this scale again, but
yes,
really, even if you think about it, we've had swine flu, we've had, thankfully, Ebola didn't explode in this country, but it's something that a lot of workplaces like healthcare organizations and smaller doctors' offices wanted to be prepared for. And really, at the end of the day, it's the most effective way to protect those who you care about and those who are going to be interacting with you. This slide just shows key results, what your goals will be. It's going to be reduced injuries and illnesses, improvements in your processes and your service quality, increased morale, as I mentioned. It can help with recruiting and retention. And as Chris just mentioned, a more favorable image and reputation among the community. And really, it's good business. OSHA has done a lot of studies on this, and they have shown that for every $1 invested into safety and health, you can save $4 to $6 in cost of workplace workers' compensation or injury lawsuits, payouts like that. So it keeps people safe and it's good business. So I really think it's a win-win.
Yeah, and it wasn't on top of mind for most small business owners, I think, pre-pandemic, but I think it's super important just even after this whole mess sort of gets fixed up. I think it's important to keep in mind because it's sort of a proactive approach to save on costs that, might come up because of not having these kinds of programs in place.
Yeah. Yeah, and even throughout the conversation today, I'll talk about ways where even you might see my slide and think, wow, this is way too formal. We're a 3-person business. This isn't going to happen. it's like I said, it's unique to your business and your organization. These programs are not expensive. It might involve some time sitting down with and just identifying things and coming up with solutions. And you might want to, depending how many people you work with, you might even want to sit down and talk to your landlords or something like that.
Right.
It's something that it's very scalable, and it's achievable for really any type of business. So these are the basic elements that I'll talk about today, and I'll go into them in more detail throughout this presentations. But regardless of the size of your organization, these elements are going to help prevent illnesses, injuries, accidents, near misses, whatever it might be. So these are going to be your core, basically your stepping stones to getting a good program in place. This is an approach developed by OSHA, and it's been, modified and perfected over the years to kind of really work and be applicable to any business. All right, so like I said, I'll go through the elements. The first one is going to be management commitment. And for the sake of this presentation, management is whoever's in charge, whoever's making the calls. So management's really important. It's, you want to start your commitment to safety from top down. So some first initial steps might be defining what safe looks like at your business. Like I said, take into account what your business is, who you interact with, who you need to keep safe, essentially. Obtain buy-in where it's needed. So do you have partners? Do you have other people who are kind of making the calls with you that need buy-in? Are there employee representatives? Even thinking about, do you have that one person that's been working at your business 20 years and everyone just trusts, right? It doesn't have to be traditionally, if you're a larger or mid-sized business, maybe it's HR, maybe it's the field workers, if you have a field team, something like that. And then some concrete steps would be something along the lines of creating a policy or a mission statement. And this can be done really in the beginning. And as its name implies, it does not have to be anything super intense. It could be really just letting your employees or your workers or your customers know that you have begun this commitment to keeping everyone safe, and that maybe there's some things that they can expect in the future. You might ask them where they feel unsafe, what they can see be improvements, etc. And that goes hand in hand with making safety a known priority. And you're going to want to define expectations clearly. So that way you kind of avoid yourself getting bombarded with questions from the start. And also, sometimes with workplace safeties, I find this really varies from, industry to industry, but sometimes there can be this misconception that it's going to mean like spying on your coworkers or, like tattling, whatever it might be. But by defining expectations and making it a known priority, you're really trying to offset any of that attitude should it exist. Your workers should know that reporting incidents isn't a bad thing. You actually want to encourage it through these steps.
Right. Especially, I know that I've gone out and I certainly haven't gotten COVID, but I'll cough and I get a couple looks and, that's also a concern, for employees. Some people take it more seriously than others, and sort of setting those expectations just across all your employees, I think, could make sure everyone's on the same page.
Yeah, exactly. And when things like that come up, it doesn't have to be like, it helps even ease the panic of some of those moments, right? Like yes, if there's absolutely. A defined plan and an employee knows what to do, or if say you do define something and they go out and practice it and it's just not working out, there's methods for, improving it and reporting it. And it's something that's looked at as a goal. It's not like you're not irritating your manager, you're not irritating right. your coworkers by doing this.
Right, right.
Yeah, so I mean, this is really the core of management commitment. We already talked about communicating your commitment. But once again, safety does need to be, a priority in the same way that profits and productivity are priorities. And it's not a competing factor, like I even mentioned before. it's supportive of productivity, it's supportive of profits, especially, depending what type of programs you have, and the way it could really support a more safer workplace and reduce some costs in the end. It's also important to take on a visible role in the safety process. And like I said before, there's some easy steps you can do to take that. But once again, it's just another thing that contributes to that trust building process and knowing that it's a part of the culture. Allocating resources, of course, like I said, depending on your program, resources could range from, just time invested to sit down and talk about this and identify safety things. It might involve, recognizing, hey, we need to get some gloves. They could be wide, depending on your business. If you're working in some high hazard environment, with some of you might be, there could be more intense resources, such as like engineering changes, stuff like that. So I don't want it to seem overwhelming. So it could be anything from saying, hey, we need an hour to talk about this, to we need to change something about the physical layout of our workplace. And creating accountability. As business leadership, as a manager, as a people leader, whatever you identify as, you want to you are responsible for your team's safety, and you want to act in a way that makes yourself accountable. And then that will really trickle down to your employees, and they'll feel accountable for their own safety, for their colleagues' safety, et cetera. And that transitions us really nicely into employee involvement, which is a really key factor in any workplace safety. I could probably talk about for an hour about how to get your employees more involved, but I won't do that to you guys today. But you can really demonstrate the depth of your commitment to workplace health and safety, to preventing illness, et cetera, by involving your employees in planning and carrying out the efforts. It is important. It builds ownership of, the systems that you're putting in place. And, this really translates to many different systems that you might be in place, whether they're safety related or not. But when employees feel like they're involved, they feel like they have more ownership and some ability to make changes and suggestions, et cetera. But it also gives you a really unique perspective that you might not have. Even if you've been running this business for years and years, you might have been in roles yourself and moved up the chain, whatever. So you might already be starting from a really good point where you're aware of what everyone's dealing with. But the pandemic was just started a year ago, and it's been a little over a year. A lot of new things have happened. So people working in different roles than yourselves, whether they be or just even existing in other roles, whether they be customers, consultants, workers, admin, people in the field, et cetera, are going to have a unique knowledge that they can contribute and help identify hazards, and just let you know where they might feel unsafe, where they feel there might be a higher risk of them contracting COVID or whatever the danger might be. And you know what, at the end of the day, they're going to make your life easier because you're involving them in identifying the hazards and the controls. So you're working as a team, and you don't have to sit down and do create this program by yourself. And like I said, even if you're a small business with two workers, 1 worker, 3, 5, whatever, think about the other people that you interact with. There might be consultants, you might have a building owner, landlord, you might be, say, you're a retail store in a strip mall with a bunch of other retail stores. It might be worth it to get together with them and kind of think about this type of stuff, so it's not all on one person. And then the last thing is, it helps give workers access to information about their workplace. And, depending on your context, this could also extend to customers or anyone who interacts. So making sure that people are aware of kind of their conditions is going to help them feel more involved, and again, increase that ownership. And one thing I like to emphasize is creating a type of reporting system. And you don't really even need to formally mention that it is, you don't have to formally name it the safety reporting system. You can say, here's the safety suggestion box. Here's where I want to hear your recommendation. But really, you just want to create a mechanism that employees can report things or customers can report things or whoever it is. It's just going to be beneficial to them, as in they can get their voices heard, and it's going to be beneficial to you because you will get the information you need. I do recommend creating methods for anonymous reporting if at all possible as well. Although I trust everyone on this call, has a commitment to safety and is not going to make it seem like a punitive thing. There are plenty of people out there who have experienced workplace safety and have spoke up about workplace safety and may have had, negative consequences in the past. So just to make it more open to everyone, I suggest having an anonymous route, even if it's not the preferred route. Say you'd rather people just go straight to their manager, that's great. And that's actually, really starts that conversation. But if, say, you have an email box or even a Dropbox, like for paper and, a little with a little slit in the top or something like that, that also works. And then once you kind of get that in place, and communicate with the employees how they should report things, what they should report. So should you want them really reporting a range of things? Say there was an incident where they felt unsafe and that they might contract COVID, they should be reporting how that went down and why they felt unsafe. Or say, the parking lot's in bad shape and they tripped on it and they could have really gotten hurt. They should be reporting stuff like that, even if it's kind of outside their business. Maybe you as a manager can talk to whoever's in charge of that and get it fixed. And of course, the why should they be reporting it? Kind of all the, things we've already mentioned, but also really want to show this slide. This is really to drive home the why of why we want to report things and not just address things after the fact. There's a few, iterations of this triangle that I'll explain in 1 second out there, but they really all get down to the same idea. If we can prevent unsafe conditions or unsafe behaviors, then we prevent, near misses, which are almost accidents. We prevent accidents where people have to take off work, and then we prevent serious injuries and we prevent fatalities. So in this iteration, and this has been, done through academic studies, et cetera, for every 300,000 unsafe acts or conditions, it would result in 1 fatality, taking averages, of course. But so really preventing unsafe conditions really has big impacts on preventing far more serious events. So that's really the why of why you want people reporting, and you want to stop things before they happen, of course.
And again, that's just the health side of it, right? There's also operationally and, financially, it just makes sense for your business to keep everything working like a well-oiled machine, a safe, well-oiled machine, right?
Exactly. And like I said before, really kind of creating these commitments and a culture that supports things like this is going to support an overall compliant and well-functioning culture in general. If people are speaking up about, hey, there's this safety issue, but hey, I also noticed this issue with our operating system or computer systems, it gives people more ownership and more involvement, and it really only benefits both parties in the end, right?
Right, yeah.
So another thing I suggest is kind of having a committee. And this is one of those slides I do like to preface, it doesn't have to be the most formal thing in the whole world. But effective safety programs really do require the cooperation of all workers of all parties. So setting up a health and safety committee is another thing that is supportive of these goals. The first thing you want to think about is size. And as I mentioned, they don't have to be large. They can be 3 people that meet quarterly. If you have a larger business with different operations, take 1 person from each department and have that meeting, whatever works for you, whatever period of time works for your business. You do want to make sure they're representative. So like I said, if you have workers out in the field, you want to make sure they're acknowledged. If you have admin workers, if you have retail workers, whatever types of functions exist within your organization, you want to make sure those are represented. Like I said, you want to have some type of regularly scheduled meeting with them. And that could be, depending what's going on, that could be monthly, that could be quarterly, it could be at the half, whatever works for your team, your business. But you want to involve them in reviewing metrics, the implementation status of any safety program, or identifying identifying hazards and what you can do to stop them at your workplace. And also this can be integrated into any other type of regular, meetings, town halls, whatever it is you do. It doesn't have to be something that's overwhelming or feels like a new huge responsibility to those who are in the committees.
So when you say review metrics, what kinds of metrics are those? Are they related to health and safety?
Yeah, so generally health and safety metrics. So have you been getting reports of unsafe conditions? Okay. Are people, or, once your program gets along, say you've identified a hazard, a risk to employees, have they been controlled? And I'll talk about how to identify those controls in a few slides. So what % of identified things have been controlled or made safer, if you will? Right. And like I said, it's really going to matter on your organization. Those are two that are probably going to be applicable to most people. Some larger organizations might have, I'm trying to think, like either like machine guarding, or they might be like more industry, number of complaints, stuff like that. Right. But it doesn't have to be this long list. But I think the two best ones to start with are people reporting and getting involved, and have any hazards been controlled? And then another thing is, get anyone who's involved to just do a quick walkthrough. If you have a physical work site, that's a great way to really just start this whole thing, is say, hey, we're having a safety walkthrough. I want you to, I'm sorry, my screen just shifted. Is that visible? All right, that's better. Sorry, have a walkthrough, have them go through the work site and say, here's something that might be unsafe. And for a lot of places, it might at the very beginning feel a little silly, because you might be identifying something like cords or that are a tripping hazard. And I just know from experience, people are like, we have one room, there's nothing to worry about, but right. Just do it. Just get the conversation started. Right.
Because the fire alarm might not have a battery in it. It might not have
a battery, and then that could be a very serious incident. Right. And it just gets people thinking. If you identify the cord that causes people to trip, then they think about, hey, actually I did, last winter there was ice on my way in and I actually really hurt my back. And, that could happen to any one of our customers, and we don't want that to happen. Stuff like that. So really getting into the core, the next two sections are going to be like what you do to identify what these hazards are, and then how do you control them. And so really trying to think about this methodically and put in an effective system instead of just, going one by one or fixing things after they happen. So a hazard is anything that has a potential to cause harm. It could be a substance, it could be equipment, it could be a procedure. If you're a childcare center, it could be a disease that a child brings in. If you have customers, it could be like we all know about, like COVID, them bringing that in. But hazard identification is all about anticipating what could happen and forward planning for any type of situation imaginable. And you can really kind of break them down into a few categories. There's safety hazards, which could cause immediate accidents or immediate injury. For example, just continuing with childcare, if you have children running around with sharp scissors, we all know that's a no-no. It's a safety hazard. Ergonomic hazards, if you're working with repetitive tasks, or even if you have workers sitting in chairs all day, they can cause sprains and strains, and they can really contribute to long-term illnesses or injuries. And then, of course, we have health hazards. This is conditions that can make anyone sick. And they range, of course, from infectious disease, which we all have been worried about for a year, but also think about things like cleaning chemicals that can make you sick, that can irritate your skin or your breathing, or if you're working outside, heat or cold stress. Those are also health hazards. So the range is kind of wide.
Where can people start? Because you don't know what you don't know. Yeah. And there might be something, that's totally out there that you might not even think is a hazard.
Yeah, so there's a few good ways. I always think, like I said before, the first thing you should do is if you have a physical site, get people to do that walkthrough, walk around and have them just look up, look down and say what could cause an injury or an illness. And then, spend the next workday writing down anything that could, they think that could be dangerous. But even if before then, Google your industry and then safety checklist. And there's a lot of stuff out there. And like I mentioned to you before, I'll put a few links. I can't possibly cover every industry in the world, but think about, especially restaurants, there's a lot out there, childcare, retail, consulting, driving, safety hazards. There's a lot of checklist type things out there that can really save you a lot of time. And then I'll also, in the slides, I'll put like a link to OSHA and CDC, and they'll have a lot of like basic information.
Right. Any restaurants that are here on this call, please mop your floors, because I almost slipped the other day and it was going to be bad, but I caught myself.
Yeah, no, exactly. Like little things like that really can cause pretty serious injuries.
Yeah.
The old workplace, I mentioned the ice example because that was actually a problem. Someone got very hurt. We think of just walking from our car to the door of our workplace as nothing. We do it every single day, twice a day. But if something gets in the way of that, really, people could get hurt, and that could cost a lot of money to remediate.
Yeah.
So just the basic list of how you're going to do this. Review all activities that occur within your workplace, your center, whatever it is. Like I said, have yourself or employees spend one day thinking about all the interactions they had and writing down if they encountered a hazard. Because a lot of times we encounter hazards and our brain just immediately moves on because you probably slipped, caught yourself, and just didn't think about it, right? Until I mentioned it earlier today, but have a special dedicated day or session where people are actually thinking about what happens during their day in the context of safety and health. Like I said, inspect the work site and then think about previous things that have happened. Have you had employees or customers get hurt doing a specific task before? Especially, is there a repetitive history? Having things happen once is going to increase the likelihood of it happening again. If it's happened multiple times, then you've got yourself an issue that you probably want to address. And then next, think about non-routine situations. So you do want to definitely dedicate the time to think about this, because this is probably stuff that is going to come up or come to mind during a walkthrough. But think about, obviously your fire and evacuation systems, but also, are you in a flood zone? Are there other natural disasters? How would you be impacted if there was a power outage or a technology failure? Or what if there was, a employee or a customer violence incident? How could these emergency situations impact your safety? And as I said before, get people involved in this process, whomever it might be. And then you want to think about the risk. For each hazard, you want to think about the severity. So how bad could it be? The frequency, how often could it possibly happen? And how likely is it, the likelihood? So like I mentioned before, floods might not be likely and it might not be frequent, but it could be severe. And I've even seen, different businesses say, we're going to rank each one, 1, 2, and 3, severity, frequency, and likelihood, multiply those. And then our higher numbers are going to be our biggest priorities for addressing. So really just evaluating the risk is going to be your system for prioritizing what we take care of first. Because whatever has the potential to cause more harm, we want to take care of that as soon as we can. And then we can get to, everything depending when we have the time and the resources. So once again, just a way that this doesn't have to be, even if you have a list 20 hazards long, you're going to have a priority system. You don't have to address them all in 1 week or just even feel overwhelmed and just not even know where to start. You're going to want a way to kind of rank them. All right. So you've identified what could go wrong. You said we have our worst problems and our least concerning problems. From there, how do you systematically think about these hazards? So in the occupational health and safety field, we call this hazard prevention. Sorry, we call this hazard control. So you're going to identify what your control options are, and then select them. And the next slide, I'm going to show you this tool that we use all the time in the safety world to identify and select the controls. But once they're selected, you want to implement them in an organized and timely manner. You're going to want to do all your basic, project management stuff for this. Just setting a timeline, identifying who is responsible, and then checking in. Is it implemented on time? Are there different resources needed? Do we need to learn a little bit about this hazard before we take any action, et cetera? And then just following up to make sure that the controls are effective. Now, like I said, how do we select them, and how do we know what's the most effective way to stop a safety hazard? So this upside down triangle is called the hierarchy of controls, and it's generally how safety controls are selected. And it starts at the top with the most effective way to control a hazard with the least effective way. So the most effective way is going to be physically removing the hazard. Sometimes this can be done, sometimes it can't be. If you have a slippery floor, for instance, we can't just stop mopping forever because that's not sanitary. Right. So it's harder to eliminate that. But if, say, there's like sharp objects or something, we might be able to replace those with something, which gets me right into substitution. So that's replacing the hazard with something less hazardous. So if you have a chemical that you use for cleaning and it's irritating, and you identify something that gets the job done but is less irritating, causes less health concern for those handling it, that's substituting. Then there's engineering controls. So this can be isolating people from the hazard. So in the context of COVID, this was a lot of our ventilation, or a lot of our disinfection practices was getting the hazard away from the people. Administrative controls are changing the way we work. So again, with COVID, social distancing, staggering shifts, so less people were in the room at the same time, just changing the way we do things. And administrative controls are considered less effective because they just rely on behavior to be implemented. And then at the bottom, we have PPE. So protecting the worker with personal and protective equipment. If you're in the healthcare field, I'm sure other hazardous, where there's breathing hazards, you're familiar with respirators. This could be head protection if you're construction or any other stuff like that. And generally the things at the bottom, like I said, they're less effective because they rely on employee worker management behavior. Whereas the things at the top don't rely on behavior. Unfortunately, a lot of times engineering, substitution, and elimination can be a little more costly. So sometimes it makes sense to think of something we change administratively, and then maybe X amount of years down the road, we have the budget to get an engineering control in place. So there's always options. We want to do whatever is effective and feasible, of course. For training and education, I'll quickly go through just to be a little mindful of time. But it's really only two basic points that you want to cover when it comes to training whoever is involved with this process. There's awareness training, which is really what I'm doing for you guys today. That's just introducing people to worker safety and safety systems. I recommend, if you have an employee onboarding system, that just gets integrated. And depending on your business, it might be just a talk. It could be a PowerPoint. It could be a pre-recorded session that you have people sit through. Really, this could be pretty flexible on how you do it. But it should help employees understand how to report safety concerns, what the hazards at your worksite are, what the controls at your worksite to protect them are, and what their responsibilities are in creating a safe workplace. So probably reporting things that are not good, things that could be a health hazard, as well as any implementation responsibilities, as well as knowing, emergency procedures, et cetera. You want to be aware of cultural competency and language needs. Workplace safety, you it's really important that it doesn't just reach a sector of your population, right? It should be for everybody, and it should be created in a way that it's accessible and understandable by all parties. Next, I'll mention hazard-specific training. So this is going to be specific to what hazards you've identified at your workplace. And, you know, some smaller office-based or other types of industries might not have a lot of hazards. But one I can always think about is an emergency preparedness plan, right? Every business probably has some type of evacuation procedure, or what to do if there's a fire, or what to do if there's, you know, some type of emergency. So that's a good example of hazard specific training. You've probably had to review what the evacuation plan is. I know we've all done fire drills when we were small and possibly when we were at work, but it's training workers on what their responsibilities are in preventing these hazards. And depending on what your hazards are, you might want to demonstrate competency or do hands-on practice. So like I said, a fire drill practice. If you're dealing with respirators, practicing putting them on and ensuring that they fit, doing fit testing. And if you know you really have any other hazard, doing some type of quiz, you just making sure your employees have the knowledge they need. All right, so kind of wrapping up, what do you do after you've done all of these steps to help protect yourself, protect your customers, protect everyone involved? Of course, we want to evaluate what we've done and improve it if we can. So like Chris has mentioned before, again, a process that really can become, you know, integrated into your whole working system, just sitting back and thinking about how was this established? Did we do all the steps correctly? And if we implemented anything, did they work correctly for us? Or do they make sense for our business? Do our employees, our customers, have they made anything harder for them? And should we change it because of that? Have people taken kindly to it, or are there other changes we should make? So in order to do this, you want to monitor any metrics that you've identified. So metrics can be leading or lagging. As we mentioned before, some leading metrics might be basically reporting and also hazard control. So have things been reported and have hazards been controlled? Those are kind of going to be indicative of how well your system is predicting hazards or predicting injuries, et cetera. And then some lagging indicators might be, what are the injuries? Have there been accidents? Have there been cases where COVID was contracted at the workplace? Have there been people who have fallen and gotten hurt? So those are going to be your metrics that you're going to want to monitor. Depending on your workplace, you might have a few other metrics thrown in there as well. But whatever they are, you know, figure out what works for your organization and keep track of them. And they're going to help see how your performance in this, you know, realm of health and safety is working. Verifying that whatever you've identified as a change or an implementation practice has been done fully and effectively. Assess what your shortcomings are and identify your opportunities for improvements. So, of course, we all know that when we're implementing anything new, we pretty much always have opportunities for improvement. Sometimes they're large and sometimes they're small. But it's just, I always recommend just keeping this evaluation process, you know, constantly in place. If it's yearly, if it's quarterly, if you do like an annual business review, put 30 minutes on the agenda to assess the safety program, 15 minutes, 1 hour, depending on the scale of things, you know? Or even just integrate it into other metrics where it's kind of talked about and you're not really even adding separate time. It's just a new metric that you're watching. And hopefully, you know, things go well and you have 0 injuries, 0 illnesses. But if something does come up, you want to address why did it happen and what can we improve to ensure this doesn't happen again. All right, and then the last thing I'll talk about is really integrating safety into the organizational culture. Like we mentioned before, this probably wasn't top of mind for a lot of small businesses. And I don't want to make it seem like this new system you have to learn, or it's like this whole extra part of your business. because really the goal is for it to be integrated into the business. And like I mentioned, there's a lot of ways you can do that. Even just having it be a part of your regular metrics or whatever you're monitoring, having it be a part of, team meetings or sit downs, whatever it might be. I'm sure there's plenty of things you're already doing in your organization where you just integrate safety and it's not even going to add on time, or it's going to add on minimal time, whatever it might be.
It's just an extra bullet point.
Exactly. Yeah. So I know I've talked about it for an hour, but at the end of the day, what you implement is just going to be a little extra step.
Yeah.
But yeah, if you have an environment where safety hasn't been thought about, it might be a little bit of a cultural shift. And that's okay. Anytime we're creating a new priority, there's going to be a little bit of a cultural shift, right?
And nobody likes change, so you might even expect some pushback on certain things, right?
Mm-hmm. Yeah, for sure. Especially if you might have that one employee or those trusted customers that is like, I don't know what I think about this, but right. Don't be discouraged when that does happen, or if it does happen. Just like any other process, that's a change. Like you mentioned, there could be pushback, but this is it's going to be part of the culture, and you're going to get to a point where really it's just expected that people think and work in this way. And like I mentioned at the bottom of the slide, integrate it into the ways of the working and your culture. If you celebrate successes in, customer management or profits or anything, celebrate safety successes as well. Encourage employees to speak up and always lead through example. If you're, business owner or leadership, your employees, your customers are going to take their cues from you in knowing how to act. And it's really going to set that solid foundation for your whole organization to operate in a safe way that is also effective, that saves you money, and that just creates an overall better culture. Because at the end of the day, even if people don't like change, people also don't want to get hurt. They don't want to get sick. They don't want to be in pain from what they do every day. So overall, it really is a positive thing. And I hope that some of the concepts I've gone through today and some of those frameworks are helpful in you getting either started on this journey or improving the systems that you already do have in place. But yeah, that's kind of what I got today. So I'll stop sharing so we can go to the Q&A portion.
Yeah, thank you so much. So let me go ahead and share my screen. So we're going to go over some questions now. Thank you, Marie. That was a great presentation. And I think it's something super important that most people didn't have top of mind before, but they should have. But now it's more, how would you say?
It's more prominent.
Right.
It's not just, business owners that have thought about it. Your customers have thought about it.
Yeah, right.
The whole world has thought about it for a year now. So even if hopefully, it doesn't always have to be COVID, but, we've spent a year being conditioned to think about what are my risks when I'm going to, location X. Right. So really people are thinking about it a lot, even if they haven't identified what it is.
Right. Absolutely. So we have first question here. Patricia is asking, is there any data similar to what is in the safety pyramid for illnesses like COVID-19?
So that's a great question. In determining, there's been a lot of studies on looking at how much time people spend in, public settings. So like, especially thinking about workers who were what we've called essential workers. So how much exposure time they've had compared to the number of COVID illnesses. So I can't think of a specific pyramid off the top of my head, but there's been a lot of studies on the essence of that, thinking about being in an unsafe location and then the number of COVID cases. And then, on top of that, it's the number of serious COVID cases. And on top of that is the number of serious COVID deaths. So yeah, that concept definitely applies to COVID. If you think about it, it's really just replacing, or creating a more specific version of it. And really you can apply it to any type of hazard too, right? It could be a safety thing. It could be other health concerns like, say, ergonomic injuries. Exposure time is going to be your bottom. And then, the most serious outcomes are going to be your top.
Right. So we have
But if I do come across any data or anything specific, I can make sure to share that with the team here, and they can probably get it out appropriately.
yeah, absolutely. That'd be great. So we have Patricia asking, what insights do you have for addressing high severity but low likeliness hazards that you won't have experience managing?
That's a great question. So high severity, low likely. The first thing that comes to mind that's going to be applicable to almost everyone on this call, like I said before, is going to be your emergency scenarios. So these are things hopefully we'll never have to experience. But what I really recommend for them is doing drills and doing practices. If you're, even I've, worked on implementing shelter in place drills and lockdowns. These are things we might not be as familiar with, or we don't know how to do at our specific workplace. So doing a drill and making sure that everything goes according to plan. And if it's your first time, not everything's going to go according to plan. So that's going to be your best opportunity to identify how can we improve it. Do we need to train employees a little better? Do we need to change what we're doing? So if it's an evacuation, do we need to change how we exit? If it's a shelter in place or something like that, do we need to change where we're sheltering? So really thinking if you can do a scenario that's as close as possible to real life actions is going to be your best bet with those, low frequency type settings that you're not going to figure out if your plan works right away.
Right. So I have an experience where I think it was my second job ever.
Mm-hmm.
And it was at a storage company, and I took note of a lot of things of their procedures because it was $1 billion company. I could say what it is because this is a good thing. Extra space storage. So $1 billion company, have multiple franchise locations, and they implement a system of a walkthrough, like what you had mentioned. And I remember doing it every morning, and then before I left, every single day. And I think that's the most basic thing you could really do at any business, right?
Yeah, that's actually a good point. And it's even, you're looking out for those things that might not happen. I'm sure there's a lot of possibilities that you just never identified in your whole time working there.
Right.
And another example too is, and that's a preventative measure, right? So even like if you have employees who are driving, just doing a vehicle check before they start driving the company van or they drive the bus to pick up people, whatever it is. Check out for things that could lead to a very potentially horrible situation. And then that way, if they're identified, you don't do whatever the dangerous task is, right?
Right. Okay, so we have one more minute here. I'd love for everyone to type into the chat, what kind of business do you have? And we can make sure to have links in that presentation for maybe a checklist, safety checklist that your industry might need, right? So if you type that into the chat, we can help you out in finding those. Hair salon, yeah, that's a good one. My grandmother had a hair salon for many years. Biggest health concern was the smoke after everyone is doing their hair. I think, to me at least, I was a kid, I was a young boy in a hair salon. Imagine that.
Yeah. Yeah. I mean, even like thinking about chemical exposure and all that stuff too.
Right. Medical device business, definitely. Are you manufacturing them, Patricia? You can just drop that into the chat. Ooh, home automation.
Okay. Yeah, so I mean, already, even with just, the 4 that are already in the chat, there's just so many different settings.
Right.
That really just thinking about, this could all be different for everyone. But I will definitely find some checklists, and I'll throw in some more generic checklists too. I know the National Safety Council has a few good ones.
Nice.
And like I mentioned before, hopefully this will take a lot of work off your guys' shoulders.
Perfect. All right, so it looks like that is all. So yeah, thank you so much, Marie. That was our Q&A. And for everyone that's still on the call, please make sure that you're attending our next event next week, same time, same place, with Arash, and it's Supplier Management for Success. So whoever put in there that is medical device business, even home automation. I know you have suppliers too. And making sure that those suppliers don't particularly affect your operations is important. So that is our next event. And just so everyone here knows, again, we are the NJSBDC. We've helped over 13,000 plus small businesses grow with no cost small business consulting, training and events starting at $0, and exclusive small business resources only available to SBDC clients. So if you want to get started, go to njsbdc.com/request-counseling. So that's pretty much it. Again, thank you so much, Marie, for that great presentation. And we're gonna make sure everyone gets those slides.
Wonderful.
Yeah, so everyone have a great long weekend because it's Memorial Day, I think, right?
Yes.
Monday. Awesome. That's it for today. Thank you, everyone. Bye.